But it is the crowds like that, the gatherings at the nation's beaches, pools, and parks that have public health officials worried about a new surge in COVID-19 cases. I spoke earlier with Dr. Imran Ali. Dr. Ali, we appreciate you making time for us. We know something as this pandemic develops is that we don't see the results in real time of our actions. There's a little bit of a delay. We know we saw an uptick in coronavirus cases from people gathering for Mother's Day, and people weren't throwing huge pool parties for Mother's Day. With these huge crowds that we're seeing in places across the country, what kind of fallout can we expect from these Memorial Day gatherings?
Well, Trevor, I'm really worried. I'm seeing that some people are beginning to let their guard down. And I know that it's the holiday and people want to get out and spend time with friends and family. We have to be careful because today, for example, in Germany, where the restrictions were lightened up a bit, there's 107 new cases, according to the health ministry, from one church gathering alone. And that's about 14 days ago on May 10th, 14 days just in the incubation period. So we may see new infections on around June 8th. If today, on Memorial Day, we really don't keep, that social distancing, ethic around us, because it's very important that we really not let our guard down.
We want to talk about the situation with nursing homes and that devastating toll that they have had. We know about 2 weeks ago, the White House urged governors to test every single nursing home employee and resident within 14 days. Now, almost half the states have failed to meet that goal. They say the cost, the manpower is just too much to get it done. How important do you think it is for nursing home staff and residents to be tested? Is it logistically even possible to get everybody tested?
But it's just not possible to test that many people, approximately 50,000 or more, in just 2 weeks' time. I mean, there's not enough manpower. And also, Trevor, it's a moving target because you see these nurses' aides who work in the nursing home, they work at several different facilities. So if they get tested on one day, they may get exposed the second day. So just testing them once a week may not be enough. And we don't have the infrastructure or the manpower to test people every single day.
On This Week, yesterday, Dr. Burke said it's difficult to tell if there's going to be a second wave of this virus. This first wave has already been so tough for everybody. What scares you the most about this possible second wave?
Well, I mean, I've been looking at the studies out there and the projections, and it really is hard to tell if there will be a second wave. With SARS and with MERS, two other coronaviruses, there wasn't no second wave. But this is a different virus because it's highly virulent. Now, what really bothers me or worries me is that influenza season will overlap with this in the fall, especially if restrictions are lightened. So we can really learn a lot of good lessons from our friends in Australia, who right now are in flu season. So we will understand exactly how bad this could be. But again, Trevor, it's all about keeping common sense, social distancing in place and not just letting our guard down completely, because we could see a second wave if we're not careful.
Now, President Trump has said even if there is a second wave, the country is not going to shut back down once again, but it is a scary thought with all the damage that we've already had.
Definitely. I always say it takes 30 days to form a habit, but it will test that out with the whole social distancing and the mask. Other countries at least have a more national approach to it. So state by state now.
That is your catchphrase. Takes 30 days to form a habit.